Hey, welcome to Life After Nursing School. I'm your host, Caroline Dana, aka Nurse Coach Caroline, and I'm here to help you, the new nurse, thrive in your career. As a former nurse recruiter, nurse manager, and now your personal new nurse career coach, I'm obsessed with making sure you don't just survive your first couple of years at the bedside. I want you to absolutely rock them. From the challenges to the triumphs, I'll be right here with you, giving you the real-world advice and support that you need to shine. Whether you're in nursing school getting ready for life after, or you're already out there in nurse life feeling overwhelmed or even questioning your confidence, I've got your back. I'll be sharing tips, tricks, resources, and strategies that are just for you. We'll dive into everything from landing that dream nursing job to slaying imposter syndrome, and most importantly, how to keep that spark alive and stay the vibrant and amazing nurse that you are. So if you're ready to tackle the things nursing school did not cover, like how to build a career, trust yourself, and keep your passion strong, then get comfortable because we are about to dive in and make nurse life the best life. Today's guest is a true force in perioperative nursing. Her name is Dr. Yasmin Sharifi, also known as the OR RN mentor. She's a seasoned perioperative nurse leader, educator who's built an incredible platform helping nurses thrive in the operating room. From her early days scrubbing in and learning the ropes solo to becoming director of perioperative services and launching educational tools for preceptors and new OR nurses, Yasmin has dedicated her career to lifting others up in this high-stakes specialty. Through her website, orrnmentor.com, she offers mentorship, resources, and real-world insights for nurses navigating OR orientation, landing that first OR job, or leveling up in their competence in a complex clinical setting. Whether you're a nursing student curious about the OR or a new grad stepping into your OR scrubs for the first time, Yasmin's passion and knowledge will leave you both inspired and better prepared for what's ahead. Let's dive in. All right, welcome Yasmin to our show here, Life After Nursing School. I'm so excited to have you today.
Thank you for having me. I'm excited to be here.
I'm actually extra excited because I don't really know much about the OR. My nursing background has nothing to do with the OR. And from what I understand, it feels like the nurses that get into the OR setting, they go there and then they die there. They love to get sucked into the OR and they never come out. So I'm really, really
Pretty
excited.
much.
Now, do you mind starting off with just sharing your nursing journey and how you found your way into the OR specialty?
Sure. So I graduated nursing school in 1987. And like all nurses, I got a job at the teaching hospital close to my house, worked on the medical floor, and just was so excited to be out working as a nurse. I spent about 2 years on the medical floor in New Jersey before my family decided to move west to California. And when I got to California, I thought, oh, I want to go work on a medical floor because that's what I did in Jersey and loved it. It was so much fun. Got a job at a great hospital in Newport Beach. And 2 or 3 weeks into it, I felt burnout. I was like, this is not for me. I don't like this. And it was too early in my career to not like what I was doing. I'm 3-4 years into it. And I was like, oh no, this is not good. So I started searching for something else. I just knew I needed a change. And I answered an ad. Back then, there were ads in papers, and answered an ad for a recovery room nurse in a surgery center. And I thought, oh, that sounds like something different. I tried it. I interviewed, gave it a shot, interviewed, and got the job. And started 2 days into that, the director of the facility said, hey, do you want to train in the OR? I'm like, oh, and you're young, right? You're willing to do anything. And I was willing to try anything. And I thought, oh, and of course, cross the red line. Who knows what's going on back there? Yeah, sure. Why not? Let's give it a shot. And I stepped into the OR and absolutely fell in love with it. And really, honestly, never looked back. It was the feeling I had when I first graduated and started on the medical floor. I got that same feeling back. And it was just amazing. I just loved it so much. I was self-taught but it was, yeah, it was amazing. And that was the beginning of my OR journey. That was my career. 30
Wow.
some years later, here I am.
I love that. I love that you said you crossed the red line because new nurses that might not know, there's definitely a barrier when you're working in any surgical setting where if you cross
Yes.
a red line, you need to make sure that you have all the proper gear on. With you're getting into sort of a more of a sterile setting.
Hmm.
You never cross that red line if you don't know what's behind it, right? If you're not
Correct.
an OR nurse.
Correct. But it's always that mystery, right? That
Yes.
mystery red line. It's like, what goes on back there? And so my curiosity got me too. It's like, I want to know what's happening. And so, yeah, there was a lot of that. There was this need to try something new. I was willing and open and also wondering, let's go see what's happening. And there we
I
go.
love that. I think what I really like about your story here so far is that you were willing to try something new and
Mhm.
you followed your curiosity and you probably didn't know you were going to fall in love with the OR, but if we don't try new things, we will
Yep,
never know. And that
absolutely.
is how we find our niche, right? Here you
Mhm.
are now with 30 plus years of experience in the OR setting and it sounds like you even said yourself you've never looked back.
No, yeah, love it. Still do. Still
Yeah,
love it.
what about it do you love so much?
Number one, I love the fact that we're so different, right? So we are so not your traditional nurse. We are very technical, but yet we are nurses. We provide care, but we provide it in a different setting. I love surgery, the whole internal organs. I know it sounds weird. I was originally a biology major in college, so it lends to the whole what's inside the body kind of thing that is really intriguing. Yeah, it's just different. And I always said that it just doesn't fit into any kind of mold, if you will. So just that being different, really, I like that. I just like that. I think it's just so cool that what we do, nobody really knows, right? It's just that mysterious same position, job, or whatever that you have to explain to
Yeah.
people. So I think, I don't know, it just lends itself to some sort of intriguing type of nursing.
It's like whatever what happens behind the red line or in the
Yeah, it's
OA.
exactly. It's mysterious, yet it's important work. It's rewarding in a different way. It's just different, and I don't know how else to explain it.
No, I love that. And I know now you are in this mentor role where you
Mhm.
help OR nurses or new nurses to the OR acclimate to that specialty. How did you get into that position? And that is now through your own business, correct?
Yes. Yeah. So I think after 35 years in the OR and the absolute love that I have for it, I feel like I need to share that. I always say, what am I going to do with it like in 10 years, right? All of this up here, I just feel like I'm in a point where I need to share everything that I've learned, the mistakes, the hard times, the good, the bad, all of that with new nurses and help them get acclimated and be successful in the OR. I had some great preceptors, some great mentors when I first started in that surgery center who really took me under their wing and just made sure that I was okay and that I learned what I needed to learn. And that just sticks with you. And how great is it if we could all have somebody like that to guide us? But I love the OR so much that I want to share that love with other nurses. It's who I am. And I love talking about it. I love teaching it. I love sharing. I love the look on their faces when things come together as you're telling them something. It's very rewarding. It's so much fun. I love it. I get excited just talking about it. Yeah.
I feel that same way when it comes to finding nurses finding their first job, lit up about it. And I agree with you when you've done years of something and you learn this knowledge and common mistakes being made or hacks that you learn along the way, you just want
Mhm.
to almost scream it from the rooftops and share it
Yes.
with people like, hey, oh my gosh, I just had this moment. Look what I
Yeah.
learned. You need to incorporate this in your nursing practice. So
Yeah.
it's this natural progression when you almost become a mentor and wanting to share that knowledge. And it's so nice for the nursing community to have someone to reach out to or to connect with that is willing to
Mhm.
share those things. There's no gatekeeping here from most of
Right.
us that really want to
Right.
help younger, newer, or less experienced nurses get on their feet. So I
Mhm.
love that you have gone down this business path in a way to help people really understand the OR and thrive in that setting.
Yeah, we need all of our nurses to stay, right? We don't want nurses leaving the profession, especially in the OR. It's so hard to recruit OR nurses. And so those who do want to be in the OR, we would need to give them the support they need to stay and thrive and love it as much as I love it and find that passion for it that I've found over the years. Yeah.
I love that. Now, I want to get a little bit more basic when it comes to the OR, just because a lot of my listeners are new nurses. They may be like me and somewhat clueless as to what do OR nurses do. So for listeners who might not know, can you walk us through the different RN roles in the OR? I know there's a circulating nurse and a scrub nurse, but what these roles are and what they do?
So in the OR, the one thing about the OR is each OR has a registered nurse assigned to it. That registered nurse, many people refer to as the circulating nurse or the circulator. That is the primary role in an operating room for the RN. Years ago, back in when I first started, OR nurses, RNs, used to also function in the scrub role, which is the role where you pass the instruments, you set up the table, and all of that. As we have progressed through the years, they have found that we can now train surgical techs or others to do that role, because really the function of the OR nurse or the nurse is to provide patient care, to advocate for the patient, to make sure that the patient is safe. So really you have the RN, who's the circulator, who is really the only nurse in the room, and then the other role is the surgical tech, and usually it's a non-nursing position. You have other people in the room, but really the RN is that primary role. So that would be it.
What does maybe a surgical case look like for the circulating nurse? Obviously, surgical cases can differ depending on what is being done. But if you were the circulating nurse, walk us through that. Are you coming into the OR and setting up the room? And what does that look like?
So our days start early, usually about 6 or 6:30, because in most operating rooms, cases start by 7:30. But when the nurse gets there, they are assigned to a room, and that room could be any surgical specialty. And it could be we're taking out a gallbladder, it could be we're fixing a broken bone. But when they get there, they're going to review their case. And when I say review their case, they're going to look at what type of case it is. And then they're going to look at, is there a surgical consent? Is the surgical consent correct? Does it match what we think we're doing? They gather their medications for the day. They gather their prep supplies, any dressings they will need, anything they need. If we're doing a laparoscopic procedure, they're going to need their equipment. So they're in the midst of getting the room ready and getting their supplies for the first case before they go visit their patient, introduce themselves, do a pre-op checklist, make sure they've got all the documents. And once everyone in the team is ready, then they bring the patient in the room, and then they're assisting anesthesia, helping putting the patient to sleep. And then they're going to position the patient for the procedure and then prep the patient before they drape and start. And then there are other regulatory things that they need to do as well as part of that. There's timeouts and checklists that they need to complete, but that's the busy part of their morning, depending on the case.
And are they doing that again in between cases? Okay, getting their new supplies for the next case? Or do they kind of looking ahead?
Yeah, normally during the case, depending on how the case is going, they may need supplies, they may need things. Once the case is done, they make sure the patient gets to the recovery area safely, and then they do it all over again for the next case. If they are looking ahead, they would ask for help to get the supplies they need, because technically they're not supposed to leave the room to get ready for the next case, but they could do certain things in that case to get ready for the next one and look ahead. But yeah, they would do it all over again once that case is done.
That's so interesting. So when you come in as the nurse, you're assigned a room, and then you probably look over that schedule and you're like, okay, I've got 4 cases today or 3 cases. And now I assume you're paid hourly, but if you get through all your cases quickly, can you get out early?
No, there's always something to do, not necessarily. Depending on where you're working and what type of facility you're working, going home early when your cases are done are not always an option. That is up to the department. I've had it in many different situations where, we do and we don't. So it all depends. But yeah, you can try.
Now, what is the circulating nurse documenting in the case? Are there probably a lot of those safety checks, right? Like double check that?
There is requirements in our documentation. There are things that have to be in our documentation. We have to document everyone that's in the room, including a vendor. We have to document, or a radiology tech. We have to document how the patient's positioned. We document where certain supplies are or equipment. We document medications that are put on the back table or given to the surgeon. We document specimens that are removed. So there are regulatory, most OR documentation is the same from organization to organization because there are requirements in that documentation. So you see the same thing over and over again. It's just different, laid out differently at different places. Yeah. And then there's areas for free texting if they need to do a narrative of some kind. But yes. And then who they give handoff to in recovery.
That's interesting. So you're doing a lot of documenting of the environment.
Yes.
That's so unique. Now, what about, are you doing any like patient assessments? Are you documenting anything like the wound was closed with 10 staples or something like that? Or that's really the surgical, like the surgeon's post-op note?
Yeah, that's part of the surgeon's post-op note. So we do document skin assessment.
Okay.
We do document Foley. And like I said, I go back to our nursing is very different. I tell a lot of new nurses, I don't know if this is good or bad, but you're not going to use a lot of what you learned in nursing school. That's going to go away. We don't start a lot of IVs. We barely put in an NG tube. We don't hang IVs. We don't start drips. We don't do any of that. We put in Foleys. We do a skin assessment, but everything else we do is a little bit more technical. We do have to document a surgical count, but we don't document when or how the wound is closed. That's the surgeon's responsibility. So there are portions of that, like I said, we follow AOR and standards when it comes to documentation, and they're very clear about what we have to put in our documents and what's required for the nurses to do.
That makes sense.
Yeah.
What would you say are some of the biggest maybe misconceptions or myths about being an OR nurse?
Ooh, OR nurses, all they do is sit, and no, we don't. We get our steps in. It is probably one of the most physical jobs. We're bending a lot, stooping, getting under the drapes, lifting. If you've never held the leg of a 250-pound man who is asleep, yeah, that's a workout because you got to hold that leg while you're prepping. It's a workout. So it is very physical, and there's not a lot of sitting. So our pedometers are working overtime.
Wow. Yeah. The positioning of a patient. It's so funny because I remember I think it was in nursing school, or actually maybe when I was a new grad, I was able to scrub into an OR to see a case. They were just wanting like the new grads to see different areas, and scrubbed into an orthopedic case. I believe a hip replacement. And I was shocked at how much manhandling there is of someone when they're asleep. We really do have to get them in that correct position. We need the anatomy to be where we think it is. We know where we're going in with our surgical devices. It was very bloody. It looked a lot like carpentry, but they're going, wow.
Yes.
And the OR nurse was there. She was gone. She was over here. She was over there. She was anticipating everything. I was like, how did she know he's going to need that? Or how did she know that he wanted the light changed? It was a lot of like cohesive teamwork. It was definitely its own animal. And I left there having a new appreciation for the person in the OR and for even the surgeons and some of the things that they do. It was eye-opening.
Yeah. Yeah. A lot of people don't realize that the work we do is very physical. There is a lot of patient moving and positioning. Yes, we have to make sure that the patient is positioned in the natural body form to the best of our ability, because when patients are under anesthesia, the body definitely changes the way it feels, and it's much heavier, and you can actually do damage if you're not positioning them correctly. So there is a lot of movement. There's a lot of physicality. There's a lot of back and forth. Yeah.
Yeah, the skin really is compromised in the OR. I heard some statistics. Naturally, we shift our body every, I think it's 10 or 15 minutes. Aware of it. We just know we got to move our pressure points. But when you're under anesthesia, you are dead weight. And I know even having total patients on a med-surg floor, those are really heavy. I almost can't imagine in the OR where every single one of your patients is like a total patient when they're underneath
Yes,
because they can't
correct.
assist you, they can't help turn with you. You are like fighting gravity, I'm
Yeah.
sure, most of your like repositioning parts of the job.
Yes, absolutely. You have to make sure that you're articulating the joints in the right direction. You're not pulling on them. You're patting those bony prominences because they're laying on, even though they're laying on a mattress, can you imagine laying in that position for 8 hours? And like you said, you're not moving, right? So everything needs to be padded so we protect their skin, we protect them from injury. So yeah, that's probably one of the most important jobs of the OR nurse is to make sure the patient leaves the OR unharmed and safe. Yes.
Yeah, I can even imagine probably those hip fractures where you have those frail elderly people. You
Yes.
can see every vertebrae in their back. That they are really high risk for
Mhm.
skin breakdown. So
Yes.
that, wow, I never really thought of it that way. So that is interesting. Now, in your opinion, what are some pros and some cons to being an OR nurse?
The pros are one patient at a time. Our ratios are 1-to-1, and there's a lot of autonomy in OR nursing. I think of that as a pro. I think that one of the other pros is the teamwork. I love the fact that we work as a team and we develop relationships with our physician partners more so than any other nursing specialty. And I think that's a pro as well. The cons, there's a lot of standing. In most organizations, there's call that needs to be taken. That work-life balance sometimes comes under that difficult decision of taking call and being with the family kind of thing, and it's a requirement. You don't get to really develop a relationship with your patients. The time we spend with our patients, it's really minimal. We get that couple of minutes, 10 maybe in the morning when we go to interview them. And that's really it. And anesthesia wipes them of all memory. So they don't really remember their OR nurse. It's tough. So that's one of the cons, I think. We don't really get to bond with patients and families like other nurses do. It's a trade-off, but I think that's probably one of the things I've struggled with throughout the years. It's that not being able to make that connection with certain patients.
And can I add a pro, even though I know I'm not an OR nurse? I
Yes.
think it would be a pro that you don't have to buy your own scrubs.
True, very true. Yes, you save money. I could
Yeah.
save money on getting your nails done and buying scrubs. Absolutely. And really getting your hair done. Like that really doesn't need to happen either. So
Under a
that's
cap.
absolutely three pros right there.
Now, you mentioned call.
Yes.
I know this probably varies from organization to organization, but in your experience, what does call typically look like for someone who's new to the OR? I'm sure maybe there's some type of seniority involved, where as you put in your time and years of employment in the OR at this facility, maybe you don't have to do as much call. But if someone were to enter as a new nurse, what do you think that would typically look like?
Oh, yeah. Normally, for a new nurse, call starts about a year into their position. It takes about 6 months to really train in the OR to be proficient. I think after a year, you are very independent and a little bit more confident in the work that you're doing. And then at that point, most organizations put you in a call rotation. So you would fall at the end of the line when it comes to the rotation. Depending on how many nurses are in the department, that will dictate how often you're on call and how many weekends, if you will. Normally, call is either during the week, it's either 16 or 8 hours, depending on what kind of shifts they have. And on the weekends, it could be anywhere from 12 to 24 hours. Some places you're on call Saturday and Sunday. Some places you'll do a Saturday and then maybe a Sunday in a different pay period, if you will. So it all depends on how they do things in that OR. But typically, yeah, it's one day a week, one weekend a month kind of thing, or one weekend every 6 weeks. Again, it all depends on how many nurses they have.
Sure. And I assume call is really just meaning there is an OR nurse on call for the off shift in case there was
Yes.
a trauma or some kind of surgical intervention that really couldn't wait for either the next day or a few days later.
Yeah, in most organizations, unless you're a trauma center, you're not staffed 24/7. You take call. There used to be a time where we carried beepers. We don't carry beepers anymore. I used to carry a beeper, but we don't carry beepers anymore. They call you on your cell phone, but you have a dedicated time, like you're on call from 7 a to 7 p. You have a requirement to be at the hospital within 30 minutes in most places. And yes, it is to provide care to patients that come through the emergency department or that are on the floor that need surgical intervention and can't wait till Monday, for example, or can't wait till the next day and need to get done. And most private facilities or my private organizations, you take call, like I said, but in trauma center, they public or private, they staff it because in trauma cases, you don't have 30 minutes. You have to attend to that patient immediately. So there's just that little bit of difference, but
So you're saying in a trauma center, there's likely no call because there's always a
correct.
there. And
Yes.
the nurses there that maybe are working, the OR nurses that are covering night shift, they're not
Yes.
necessarily always in the OR. They're hanging out in the call room or something like that, waiting for traumas to come in.
So in a trauma center, they staff it like they would a med-surg floor. So you have nurses that work days and nights, weekends, holidays, that
Wow.
there's shifts. There's no call. So there's always teams in the OR at all times because we always have to be ready and on alert if we get a case that can't wait. It's just a smaller group. We don't staff for the entire OR on the night shift. We staff for a smaller number, but still yet they have to be on site in the OR ready to go.
Oh, that's so interesting. I can see good and bad with that, right?
Yes.
You might get stuck working kind of the off shift, but maybe
Mhm.
it's a lighter workload.
Yeah, there are nurses that really like that night shift. There are nurses that love working the night shift. The night shift in a trauma center is definitely more exciting. That's when you get your motor vehicle accidents, your gunshot wounds. There are people who just love that and love working nights. And so it works out, just like you have day people who love working days. Yeah.
Yeah, that would be a little more exciting, I would
Uh-huh.
think.
Yeah.
Now, if a nursing student told you that they wanted to be an OR nurse, but they have had zero hands-on OR clinical experience, they didn't
Mhm.
rotate through an OR, they really don't know what it's like to be an OR nurse, what
Yeah.
would you tell them?
So a couple of things. So if they have never been in an OR, they had the 1 or 2 days during nursing school and it's piqued their interest, I would definitely tell them to seek out opportunities where they could intern or shadow in an OR. If that's not possible, I always direct them to YouTube and tell them to see if they could find videos that sort of depicts what OR nurses do, just so they have an idea. You don't have to have any kind of experience in order to work in the OR. You just need to have a love and a desire to want to be there and enjoy the work. The challenge is because we are across a red line, a lot of people don't know what we do. It's difficult to know if that's something you love doing. So the more you can seek out on your own, whether it's through an internship, whether it's through volunteering, videos, anything like that, to get a sense of what OR nurses do, the better. But no hands-on experience is totally fine because we will teach you how to be one.
I love that. That was going to be my next question. Do you
Mhm.
recommend they have med-surg experience prior to, but since it's its own animal, only behind the red line, I guess you don't necessarily need that med-surg experience before.
No, it used to be, again, when I graduated, it was like you had to have that year or two of med surg before any OR would look at you. Nowadays, given our nursing circumstances and shortage and that kind of thing, it really isn't necessary. And we have found, in my experience, that it doesn't really make that much of a difference when it comes to learning how to be an OR nurse because it is such a different animal. And it's just, yeah, it's just so different. If you come with med-surg experience, that's a plus, but it doesn't make or break you as an OR nurse, if you will, because again, it's just so completely different.
Okay. Now, how long is a typical orientation for a new nurse? I think you said 6 months to
Yes.
train, but not
Yeah.
really truly proficient until a year.
Yeah, the Periop 101, which is what most organizations use, which is what I've used and currently use, is a 6-month didactic hands-on program. It's like a nurse residency, if you will. It gives you the foundation, and then you take that and you apply it in the operating room with a preceptor. Once you're done doing that, you have the basics and the understanding of what it is to be an OR nurse and your role. The next 6 months are spent really fine-tuning what you've learned. I like to take the nurse after that for about a month or two and give them a little autonomy, but yet keep that preceptor at arm's length so that they can call on someone if they need help, but let them start to function in that role independently. And then usually by month 9, they're getting into a rhythm. And at the end of the year, they're pretty much good to go. Yeah. So it takes a little time. I tell people don't rush it. It's something that you will learn as you go along. People think, oh, I need to know this now. And why don't I know this? And it's okay. Give yourself that grace and time to learn it. You will. It just takes time. It'll all come together. You can't rush something that's so foreign to you. You have to learn it. And yeah.
I know, I think
Patience.
is quite common for nurses because I call somewhat overachievers. This profession does attract a certain person to it because it's not easy. And I know it's so hard to be new. We're all so eager to feel confident and to know everything and to be a valuable team member contributing. But that is such a good piece of advice that you said. Take your time when you're orienting. Give yourself some grace. It takes time for everyone to really get up and running and build that confidence.
Yeah. Yeah. We were all new at one time and we were all there. It takes time. It takes time to be, don't look at me. I've been doing this for 35 years. You're comparing yourself to the wrong person. Don't compare yourself to anybody. Do your thing. And trust me, if you do what we ask you to do and you take in the information and you want to be there and you love it, you're going to learn it. It's going to all come together. And then you'll look back and think, oh yeah, she was right. It all clicked and it's happening. Yeah. We just need to be easy on ourselves.
Yeah, it's nice to know too. Okay, Yasmin here is saying that it takes like about a year to really be proficient. So knowing that ahead of time, hopefully you can remind yourselves if you're a new OR nurse thinking, oh man, will I ever get this? It takes a year. So give yourself some grace. Now, what are like some of the most common struggles or obstacles that you have found new nurses face when they are orienting to the OR? Are there a few things that kind of come up over and over again and are quite common for new nurses to really have to maybe dig their teeth in and learn and spend extra time doing?
A lot, I would say most of it. It is so different. It can be very overwhelming, right? Because again, it's nothing you learned in nursing school and it's nothing you learned on the med-surg unit. And it's so different. There are pieces of it that people struggle with and it varies from person to person. I think the biggest thing I see is that overwhelm that starts to happen when they do get out in the OR and start working and it's coming together, but yet it's coming together very quickly. Things are happening very quickly and the stress that goes along with it. And I tell people, just take a deep breath and relax. It's going to be okay. But every nurse struggles with something differently than someone else. Again, it will all happen. We just have to relax and let it just
happen naturally, right?
Yes.
Now, what are the most important clinical and even non-clinical skills an OR nurse needs to master?
Critical thinking is very important. You have to be a very organized person and learn to prioritize tasks. It's so easy to get involved and wrapped up in the craziness of your case. And those are things that also come with time. But someone who's very organized, organizational skills are very important. Someone who can stay calm under pressure and the stress of it all, and really great communication skills. We communicate a lot in the OR. And that's a part of being a team, right? You have to be able to talk with each other. You are not there by yourself. So just being able to do that, I think those skills are probably the most important. Clinical skills are those you'll learn those skills. Aseptic technique, and I think is probably the most important one, but it's the non-clinical skills that you'll learn and need to come with a little bit and then refine once you're in the OR.
Sure. What about advocating for your patient and like finding your voice? Being the only or like the primary nurse in the room, another skill that you do need to master and develop because I'm sure there are a lot of strong personalities in and
There are. Yeah. Yeah. Advocating, I think being able to speak up and being able to voice your concerns, that also comes with time as you get comfortable in your role and you get comfortable with the team, being able to say, hey, this isn't working or whatever the case may be. You find that a lot of nurses at first are very shy. Oh, can I say that? Oh, I don't know if I should say that. And I'm like, absolutely. Say what you got to say. This is your one shot to say it. So you need to say it. So yes, being able to speak up is very important and being able to advocate for your patient. And all of that does fall under just being able to communicate and get your point across to everyone very clearly is important. Yeah.
And so it seems like if someone is out there listening to this show and they are a new grad in, let's say, med-surg, dreams of going to the OR. What is nice is that I am sure, learning in med-surg things like organization, prioritization,
Yes,
time management, advocating for patients. And those skills will be ones that will transfer to the OR. The
absolutely.
skills, not so much. That might
Right.
be new, but at least they may have a foundation for those other things that you have emphasized are so important in the OR.
Yes, absolutely.
Yeah, I do love that. Now, I definitely want to ask you this next question. What is it like working with surgeons in a high pressure environment? I have heard horror stories, and then I've also heard some really fun times. So I'd love to know your take on working with surgeons.
I have worked with all kinds. So I'll say this, you have to be able to read the room when it's a good time to talk to your surgeon and when it's not a good time to talk to your surgeon, when your surgeon is stressed and when he's not or she's not stressed. And this goes back to also understanding the case that you're doing and the intensity of that procedure, and when they're in a position or in part of the procedure that is touchy, right? Stressful, and when it's okay to turn up the volume on the music and start rocking out and having a good time, right? So it's really important to be able to know those nuances in the OR and understand your team and your surgical team. I think, and that comes with time as well, just getting that understanding. But that's where relationships are built as well, right? When you know the person you're working with and you know when to interject and when not to, and when they're stressed, and when you as the OR nurse need to keep things calm and quiet so that you don't add to their stress. That's, I think, the fun part of what we do, or what I do as an OR nurse, I think, is just understanding all of that and being able to manage the room, because that's what you're doing.
Yeah, it almost sounds like having emotional intelligence enough to pick up on those little cues. Okay, I can tell this surgeon right now, this is a difficult case. We know this patient is complicated, and here they are at the most critical time in the procedure. I'm not going to ask a question.
Exactly.
I'm not going to poke the bear.
Correct.
And also, it sounds like over time, you probably learn each surgeon to a degree where you're like, okay, this one, I can ask all these questions. Okay, this one, I know I need to wait. And you have to put on these different hats of, okay, I'm in the surgery with this surgeon. I know how to act, or I know how to manage the room to the way that will support them.
Yeah.
At the end of the day, I can't even imagine being a surgeon with that much pressure to really go and alter someone's body and hope they do the best that they can. So I can understand where sometimes there are eruptions in the, I think having the emotional intelligence to know when to talk, when to turn up the music, when to change maybe the surroundings or jump in and help is probably what makes a certain OR nurses the cream of the crop.
Absolutely. Yeah. You have to, exactly to your point, there has to be some emotional intelligence. You have to really be involved in the case, right? You have to listen to what's happening. You have to listen to his or her voice going up or down, right? You have to understand the intensity as it's happening. It's very critical. And yes, that does differentiate the great from the good from the bad, those who can't. If he's throwing an instrument, I think he's not happy, right? You might want to pick the head up and find out what's happening, but that doesn't happen very often anymore. But yes, you have to be aware of those situations. And that's a great point. Yeah, absolutely.
Now, I was mentoring a nurse and helping her find a new job. And she was telling me she had started in an OR and she had like little preference cards that she was studying. Is that kind of common for new nurses or new people into the OR setting, like learning this specific organization?
Yeah, what's really great about what we do is we do have these preference cards exactly on each of our surgeons and each procedure that they do, with all their nuances and what they like and what they don't like and what they need and what they don't need. And what I tell every OR nurse that's new is that they should always be carrying around a notepad and pencil or pen and jotting these cards down, either making copies of them or jotting down the nuances in their little book, because those will be very helpful someday. Yes, but preference cards are a thing. We call them recipe cards, whatever you want to call them. It does give us a little bit of a roadmap of how to prepare for a case. And we also use it to write little notes on there to alert other team members to Dr. So-and-so doesn't like country music, so don't do that. Or he likes the blue gloves and not the green gloves and those things. So he likes to stand on the left side and not the right side. We get really down to some specifics, but yeah.
I am laughing. Really, I feel like as nurses, there is no job too small. We really do it all. We're trying to keep everyone
Exactly.
happy. And at
Yeah.
the end of the day, the music preference, yes, we're doing it for the surgeon, but it's because we want the surgeon to do their best work on our patient. So it really all comes down to the patient and their outcome. But I have to laugh because it just seems so silly. But some of them I know are superstitious. There's certain things they like, temperature, certain degree, fan over there. I do feel like there are some of these little nuances, but put all together, hopefully we are setting the surgeon and the surgical team up for success.
Yes, ultimately, at the end of the day, we're doing this for the patient.
Yeah.
If the environment is good, then the procedure goes well, and that's really what we're trying to do. But yeah, there's some crazy requests sometimes and some things, but it's all in fun and it makes the day just go better and easier. But yes, to your point, whatever we can do to make the day fine and the surgeon happy, ultimately we're doing it for the patient. Yeah.
Do they know that these recipe cards exist? Are they like, hey, add to my card XYZ? Yeah, I feel like I'd be changing my card all the time.
They do. And they do that because we oftentimes they'll say, change that suture on my card because I want to use this one now. So they know they have these cards. We are very open. They actually help create the cards because again, we want to give them what they need to do their case and so that it's stress-free. So the more we could put on the card, the better. Some surgeons, if you're asking him the same question every time he shows up, it's a bit annoying. We would all be annoyed. It's like, it's on the card. Read the card.
Yeah. And it's nice for the nurse to have that tool too, because I'm sure it gets confusing and hopefully it prevents you from being in the middle of a case and not having what they want.
Absolutely.
And then the patient's open on the table and you're probably calling out for help to go find some special thing that who knows, maybe they don't even have ordered. Now, do our nurses do they tend to specialize over time? Okay, I am an OR nurse that specializes in like open heart surgery, or do they like pick a service line, or are they more like general?
Both. So it depends on the organization. There are organizations that are pretty large and have nurses that are on teams and specialize. And then there are organizations where they're too small to do that and nurses do everything. So yes, if you're looking to be a neuro nurse and all you want to do is neurosurgery, brain surgery all day long, you would look for a hospital that has a neuro team and you would specialize only with that in that field. The only issue that I see with that is if you ever choose to leave to go somewhere else, it makes it very difficult for you to be able to do other cases and you would have to be trained all over again. So if you're doing that, then you're going to stay for the long haul because a neuro nurse then can't do ENT or eyes, nose, and throat or general surgery or anything like that because all they know is neuro. But definitely we have ortho nurses who just do ortho and they love doing that. And that's totally fine. That's great. But it does limit you just a little bit. So
that makes sense. It's like a specialty within a specialty, right?
Yes, exactly.
And then if you ever want to leave that organization, but stay in that specialty, I'm sure it's so hard to find a job elsewhere.
It is, again, because a lot of hospitals don't do that. It depends on the size of the organization. Yeah.
Is there a case that's your favorite? And then is there a case that's your least favorite?
Yes, I never loved urology. I don't like urology. And GYN laparoscopies, hysterectomies used to bore me, just put me to sleep. My favorite cases, orthopedics. I love orthopedics and neurosurgery. I love the brain. It's just an amazing organ. It's an organ. Yeah, those are my two favorites.
I also feel like, and this is a huge stereotype, so I could definitely be wrong, but I feel like in ortho, they are a little bit more upbeat and they're playing music and there's blood squirting everywhere. Like I said, they're taking out their chainsaws and their carpentry tools.
It's very true. It's drill, tap, screw. I always say drill, tap, screw. If you could do that, hey, you go home, you're like, hon, I can fix that cabinet, no problem. Give me a drill, give me a screw, give me a tap. But yeah, it's that way. It is fun though. It is a different vibe, definitely.
Oh, I'm sure.
Definitely.
Now, are there any certifications that you would recommend for nurses that are looking to advance in the OR specialty to get? Are there anything that I'm sure there's got to be some type of like board certification once you get?
Yes. CNOR is the most common certification for nurses after they have completed 2 years as an OR nurse, I think is the recommendation, or the requirement, I should say. They can study and sit and be certified by CCI, which is the certification governing board for AORN, and they can be certified nurses. They do have, I believe there are subspecialties. I think there might be one for ortho and GYN that AORN is also developing, or CCI, I should say, that they can also do. But CNOR is the most common and the most widely known. So yes, and I highly recommend it.
Okay. Now I want to pivot a bit, as when the listeners in the show know that I have a passion for helping new nurses get to the job that they want right out of the gate in nursing school. So if someone is diehard, hoping to get into the OR, is there anything that a nursing student can do either in nursing school to make themselves more competitive as a candidate for an OR residency? Anything they can do or ways to stand out?
I think the best way to do it in nursing school is, again, to find an internship if possible, or some sort of volunteer work in the area. That I think the most important thing is you want to go into the interview, if that's where you want to go, showing the people interviewing you that the OR is where I want to be. It could be the smallest step, right? You could just say, hey, I've been studying YouTube videos. I would be like, oh my God, that's great. Or go into the interview knowing a phrase or two. To me, that's, you took the time to look that up. Wow. You want to show that this is where you want to be by just doing those little things that show the person interviewing you that, yeah, I'm serious about this. So much so that, I don't know, went on AORN and joined, became a member. And that might be a little pricey for nursing students early on, right? But I was on the site or I read the articles, or I went to a conference, or bought the book on Amazon, even if it's used, Alexander's Care of the Patient, and started reading it. All of those things to me would be like, wow, I would be so impressed, because you're making the effort, you're taking that extra step to get to know what it is to be an OR nurse. And it doesn't have to be anything huge. It's just a little, that little bit.
You're not just saying, I want to be an OR nurse. You're like, I
Correct.
want to be an OR nurse. These are some of the steps that I've taken to start my own training and education and knowledge
Absolutely.
around the specialty.
Yeah.
I definitely agree with that. And I think the more you can learn, even on your own, like you said, videos, books, also the more that the hiring team is going to believe you understand what that job will look like. Because fear for the hiring team is, okay, you think you want to be an OR nurse, but you have not lived it yet. You might not even truly know what they do. If you watch any Grey's Anatomy or shows like that, OR nurses don't even exist. Honestly, nurses in general don't exist in a lot of these shows. We're sitting at the nurses station and the doctors are getting patients out of bed.
Really?
So I think if you can show that you are learning things, and what you're learning, you're excited about, and you're taking the initiative and you're committing to some of these things, to even have a job, really does show your true commitment and your level of seriousness taking on this potential specialty.
Absolutely. Yeah. Because it's a huge commitment, right? You want to go into it as when you're interviewing, we want to know that you are okay with that commitment. That's what you want to do, because that's a lot to take on. You're studying and you're learning all over again. And so is this really one you don't want to find out 6 months later?
No.
Yeah.
So true. Now, I believe you have a guide that is how to interview to land that job.
Yes.
In that guide, you do emphasize creating a portfolio and ask smart questions. Can you share with the listeners maybe a little bit about what you mean by a portfolio and asking these smart questions?
Yes. So the portfolio is really, it's very impressive when you come to an interview with a lot about yourself. We don't talk about ourselves enough in our interviews, and we need to. And your portfolio could be as simple as a cover letter, a resume, your letters of recommendation, nicely letterhead, nice paper. To me, that shows that you've taken the time to really take this interview seriously, right? And that speaks volumes. Already you're setting the stage, right? First impressions are lasting impressions, and it's a wow thing. Talk about yourself. This is where I interned. This was my summer job. Here's a letter from, I don't know, I was a zookeeper, whatever you did, everything that you did has a part in it in your nursing journey, whether it was in a hospital or in somewhere else, customer service, whatever. Talk about that. Show us, present it. It really does say a lot. Smart questions. A lot of our nurses graduate and go to these interviews so unprepared, and it's painful and it's sad because they have so much to offer, but they don't know how to tell us. I actually am going to be coming out with 15 questions and answers that you should know at any interview so that we can start preparing our nurses for these interviews. It'll have the questions that are normally asked and the answers that you want to think about giving. We need to come to our interviews prepared to answer some tough questions, but also talk about ourselves, be open. And then we also need to ask questions. I always tell people, I'm interviewing you, but you are also interviewing me. You need to know that this organization is the right fit for you just as much as we need to know that you're the right fit for us. So ask the questions, ask me anything you want to know, and walk away knowing that this is not the place for me, or yeah, this is the place for me. So think about those questions that you're going to ask and what is it that you want to know. And it bothers me when I ask them at the end of the interview, do you have any questions? And they say no.
I know, it's such a kind of moment.
Yeah.
I say the exact same thing, Yasmin. I am like, do not come empty-handed. Or many people say, what if all my questions get asked or get answered naturally throughout the interview? I say, you still say to them, well, I have a list right here of questions, but we actually answered all of them in just our discussion. So at least the hiring team knows, okay, you came prepared, you are taking this serious. But when you say, no, I don't have any questions, it feels like you just showed up and this was just an exercise.
Exactly. Yeah, exactly.
Yeah. My favorite question that I emphasize and really encourage new nurses to ask in an interview is, can you tell me about a time where you had a new grad nurse on orientation that was struggling and what you and your team did to support their success? Because that's really going to show you how the organization handles those situations. And so, God forbid, if you find you're struggling in a few months, you hopefully have an idea of how they would support you. So I totally agree with you. Come with a list of questions, please. It's simple.
Yes,
it really
is. It is very, and now we have ChatGPT. Like you can ask those questions.
Absolutely.
Yeah. So yeah, just show us that you want to be here and you're taking this seriously. It really is really the whole crux of the matter here.
I agree. Now, can you share some of the services and resources that, you have through being an OR mentor that have helped nurses or can still help nurses orient and thrive in the OR?
Yeah. So we have our Across the Red Line, which really goes through the OR stuff, I'll call it, that your preceptor normally doesn't go over with you. Neither does AORN. It covers those areas that aren't covered in a normal orientation and just adds more education to what you've already learned. We've got Consent 101, which goes over consents. In the OR, consents is what we live and breathe off of and work with. And there are just so many nuances to the consent world. The guy just breaks things down for you and just gives you some more information and helps support that when you're working and trying to figure those things out. And then I have a pharmacology book. The drugs in the OR are different than the drugs that you learned about in nursing school on med-surg. We don't use a lot of them. Our drugs are very different. And so we have a guide that sort of gives you what the drug is and what it's used for and all the indications for use and all those good things that you don't learn about in nursing school. And you really don't get a lot of it in your orientation in Periop 101 either. This comes after, and it's part of just your learning process. So we just put it into a little guide. And like I said, I do have a guide coming out with 15 questions and their answers that you can take away and learn from if you are going on an interview, and helping you think about what possibly could be answered in formulating some responses and just being prepared. I think it's really the start of it all.
Definitely. Now, are these interview questions specific to the OR?
Not necessarily. So the ones a few of them in the guide we start out with some general questions that most all interviews will ask, and then we get a little specific, but you could tailor it to any area. Any question that you answer, just take out OR input, ICU. How do you deal with a difficult family in ICU? How do you manage a family? What if any one of them could be turned into any area of nursing? It's just to get you thinking about what could possibly be asked and how would I answer that question? And then there's areas for you to take notes on and start that process.
Now, the Across the Red Line and your pharmacology resource, are those digital courses? Like
Yes, they are. Yes, absolutely. Yeah. And the pharmacology is a digital, you can download it and keep it in your favorites and refer to it when you need it.
That's great. Those are definitely wonderful resources to add to any orientation in the OR. Now, before I ask you your last question or our last question here, where can everyone find you to learn more from you about the OR, to find those resources you just mentioned? Where can people find you?
So they can find me on orrnmentor.com, and I'm also on Instagram, orrnmentor. They can also DM me if they have any questions. I'm always happy to answer OR questions that are pressing. I try to get to them as quick as I can, but I think I just want to be of help to our OR nurses, and I want to be out there and available to them. If they need someone just to talk to or to ask a question, they can definitely reach out to me. And they can email me at hello@orrnmentor as well.
Great. Now, last question for you. If you could go back to new grad nurse Yasmin, what would you tell her in regards to nursing?
I would tell her, great choice in your field. There's so much you can do. Just be open to it. Learn as much as you can, experience as much as you can, and find your true passion, because that will take you far. I get choked up.
Love it so much.
Yeah.
It's really a wonderful career choice. You just have to almost see what falls into your lap.
Absolutely. Very much so.
Thank you, Yasmin, for taking the time to share your love of the OR with us today. And the new nurse community is really grateful to have you in its corner. So
I appreciate you. Thank you so much, Caroline. You too.
All right. Bye.
What an incredible conversation with Yasmin, the OR RN mentor. This episode offered an in-depth look into the world of operating room nursing, from Yasmin's inspiring transition from med-surg to the OR to the technical, physical, and collaborative demands of the specialty. We unpacked the critical role of the circulating nurse, the importance of patient advocacy during surgery, and the unique culture and teamwork within the OR. Yasmin generously shared her expertise on orientation timelines, skill development, and actionable steps for new nurses and new grads looking to break into the OR, emphasizing that curiosity, preparation, and perseverance go a long way. If this episode gave you a better understanding of OR nursing or sparked your interest in the field, share it with a friend who needs to hear it. And if you've enjoyed this conversation, please take a moment to rate and review the show. It helps more nurses find this kind of valuable insight and support. Well, that's it for today's episode of Life After Nursing School. I hope you feel more confident and ready to tackle the challenges that come with starting your nursing career. Remember, the first year or two might not be easy, but with the right mindset, you can overcome anything. If you found value in today's episode, I'd love for you to hit that subscribe button so you never miss a future episode. Also, please consider leaving a review on your favorite podcast platform. It helps so much in reaching other new nurses like you. Thanks for listening, and remember, you've got this. Take care and see you next time.